pediatrics, and this is like honestly one of the major topics for pediatrics is GIT constipation. So we can divide this into two key areas, guys. We want to divide this into path or functional constipation, right? So pathological constipation basically means delayed meconium passage. So that's basically that we're getting delayed meconium passage, and we're gonna can be also due to Down syndrome, Hirschsprung disease, or any sort of intestinal atresia or stenosis. Okay, why does Down syndrome cause constipation? Well, the reason that Down syndrome causes it because it kind of lowers the muscle tone. Okay, and makes it difficult to pass feces. And we can also get atresias, we can get Hirschsprung disease. So Down syndrome it's a big problem. It can cause pathological constipation in children. Guys, one of the key features I want you guys to know is a weight gain. Poor weight gain. Poor weight gain means we have Down syndrome, hypothyroidism, inflammatory bowel disease, celiac disease. We have all of these syndromes. But if he has like abdominal distension, that can occur due to feces or stool. If he has poor weight gain, yeah, that's problematic. If he even has blood, it could just mean he's straining. It doesn't mean pathological. Once we have poor weight gain, that's important. Narrow ribbon-like stools, blood in the mucus, and bilious vomiting or fever. We can have some sort of problems with the displaced anus. I could imagine that's due to the increased rectal tone. And there can be sacral abnormalities, so the hair tuft can be there, and we can have abnormal lower neuro findings and weakness and severe abdominal distension. Guys, we need to work up for celiac disease. So we want to do the celiac disease leads to constipation due to chronic inflammation, due to the diet is low in fibers, as the patient has reduced gluten intake. So that's really important. Next is hypothyroidism, guys. Hypothyroidism slows down the gut. Then we can have Hirschsprung disease. So Hirschsprung disease is the absence of ganglion cells, agangliocytosis in the distal colon, and the fact that we're going to have agangliocytosis, that's essentially going to lead to your inability to kind of relax that area, and that can lead to function obstruction in that case. We can also have cystic fibrosis, which causes sticky mucus to occur. So the sticky mucus can kind of block these ducts and pancreas and prevent enzymes from reaching the small bowel. Undigested food can cause that constipation. Tough to hear in the gluteal, does mean damage to the sacral nerves S2 to S4. That really stops the autonomic system over here, and that can really lead to of the anal sphincter and all of that. Let's come into functional constipation over here. So functional is going to be, when we start to introduce school, we start eating solid foods, or we're going to, for example, be toilet training. We're going to get a lot of functional constipation, or we're going to have an absence of pathological features. There's going to be painful, infrequent, large caliber pellet-like stools. Pellet are basically like small, round, and compressed masses of substances. We can have fecal soiling, so fecal incontinence, and we're gonna have absence of pathology. So we're gonna have no problem with weight. Weight is gonna be fine. Malabsorption, maybe some anal fissures, but that's not problematic. They do ask this sometimes, guys, how to treat functional constipation, and the treatment is going to be with like dietary. We want to just make sure we can give some purines. I need to look into this again, but okay, guys, I got a really important question here from the U World. So, 7-month-old boy, he comes with the streaks of blood in the stool, hard pellet-like stools, firmness in the left lower quadrant, and at 6 o'clock. What is the next best step? So, you just want to modify the diet, really. So we have a hydrolyzed formula which contains less allergenic proteins, which is the incorrect answer. What we want to do here is that we want to add purines or to puree, which is kind of like an osmotic that kind of pulls water on the stool. So guys, just wanted to come over here and really recap this pediatric constipation. Pediatric constipation, we can think about pathological, can be Down syndrome, so kind of relaxes that muscle tone, gets quite relaxed in Down syndrome. We can have Hirschsprung disease, atresia, stenosis over here. We also want to look at the any problem with weight gain, guys. Recall that weight gain is super important. Narrow ribbon stools, blood mixing with the stool. We want to look into that. We want to look into displaced anus, hair tuft. We can increase rectal tone. We want to look at any severe abdominal distension, and then we want to treat the underlying cause. So celiac disease, guys, remember that there's going to be a lack of gluten. When you have a lack of gluten, you're not having fibers, you're going to be having constipation. We want to be thinking about, like, for instance, like hypothyroidism thyroidism or rule out that. We look at the sacral abnormalities because that can damage nerves, really control our gut system over there. A function, guys, is pretty chill when the kid goes to school. He's getting totally trained. We're introducing solids, or we're gonna be having no problem with weight gain. Abdominal is me mildly distended. There may be some blood, but blood is not problematic in children with constipation. We want to just add some purine, add some osmotic flavor into that, help them relieve their constipation. So that was it, guys. Hopefully you guys found this video useful. Reviewed some pediatric constipation topics. Thank you guys for watching. Hope to see you guys next time.